Hello everyone, I am Dr. Tanvi, your homeopathic physician, and welcome to my channel HomeoHeals. So, October is celebrated as Breast Cancer Awareness Month, and on this occasion, I am going to create awareness about breast cancer. So, let's begin with the talk. I am Dr. Tanvi Mahant. I am practicing homeopathy since 2014. I am founder and owner of HomeoHeals Clinic at Malad West. I am also an assistant professor at CMP Homeopathic Medical College, Vileparle, and honorable physician at Sri Mumbadevi Homeopathic Hospital. I have started this YouTube channel HomeoHeals with a basic aim on spreading awareness about health, wellness and homeopathy. So let's begin the talk. Today we are going to talk about what is cancer and how does it spread, what is breast cancer and few statistics related to cancer, signs and symptoms of breast cancer, risk factors of breast cancer, types, and at the end I'm going to talk on screening or prevention of breast cancer, which is very important. So please watch my video till end. So what is cancer? So if you see here, these are our normal cells and these are the abnormal cancer cells which are being seen here. And these abnormal cancer cells have a tendency to multiply in our body. So abnormally these cells keep on multiplying and it replaces the normal cells. If you see in this last image, you do not see your normal body cells which are all replaced by cancer cells and what we call as malignant cancer, which is dangerous because this has tendency to invade. That means it spreads to your surrounding entire tissue and then it spreads throughout the body. So in this image you can see that this cancer cells can break your blood vessels. These are your blood vessels, that is your blood, and lymphatic vessels. So these cells can spread all over your body through your bloods and lymphatics. So that is why you see breast cancer can spread to your liver, it can spread to your brain, it can spread to any part of your body with the help of your blood and lymphatics. And that is what we call as metastasis of cancer or spread of cancer. So coming to breast cancer, this is your breast tissue. So you have your ducts, lobules. You can see these are your ducts, lobules, and this is the breast fat and muscle. So now when the cancer cells developed in the breast and they outgrow the number, they increase in number in your breast, we call it as breast cancer. And it can happen in any part of your breast tissue. It can happen in your duct, it can happen in your lobules, it can happen in the surrounding connective tissue. So that is where we call it as breast cancer. Now coming to some statistics, if you see this image over here, this tells you about the incidence, that new cases which are detected of cancer specifically in India. Now few years back, cancer cervix, CA cervix was the most leading cancer in our country. But since few years the trend is changing and CA breast, CA breast, this yellow, this pink color which you see, CA breast has been increasing in our country. So these are the percentage of new cases, which is almost 27 to 28% of new cases we see of breast cancer every year. And if you see mortality rate, that is the death rate of cancer, is also pretty high in India, which is 23%. So these are the statistics which have been taken in 2018. So this is the same throughout the year. Talking about few more statistics. Now in this graph I want to show you that initially breast cancer was seen above 40 years or above 50 years. But the trend is again changing where you see CA breast more in 30 to 40 years of female now. So if you can see, this blue graph shows you about the old cases which are 25 years back statistic, and this is a red one is your present statistics. So if you can see in this graph, this is age in years, so 20 to 30 years and 30 to 40 years female, the incidence of cancers, the new cases detected of breast cancers has increased in India presently, and which is a big reason to worry. Now, most important point in this, what are the signs and symptoms of cancer? So this is a very important point because it is said that till any family member in your doesn't suffer from breast cancer, we are not aware about this entity, and we are not aware of the signs and symptoms of breast cancer, because of which majority of females in India are detected late. So there are stages of cancer. Majority of females in India, according to the research, are detected at stage 2B, stage 3, stage 4, which is the late stage of cancer, and that is why the death rate or the survival rate of Indian females is very less as compared to the Western countries like USA, Australia. The survival rate of females with breast cancer is almost 80%, 80 to 90%, and in India it is only 60%, because in developed countries like Australia and USA, the females are well aware about the signs and symptoms. They regularly follow preventive steps or screening test which I'm going to talk about at the end. So which is very necessary in our country like India also. So talking about signs and symptoms. So these are the various signs and symptoms which you can see in your breast. First is constant breast pain or nipple pain. So any painful area in your breast. The nipple, either both the nipple or any one nipple gets inverted, that is, it starts turning inward. If you see any rash or redness or color change in your skin and nipple area of your breast, usually we know how does our breast looks like. So if you observe that if there is any size or shape change of your breast, suddenly one of the breast appears a little abnormal, dimpling of the skin or change in the skin texture of your breast, lump or thickening in the breast and underarm area. Now this is the symptom which is seen in majority of patients. Lump, that means you see a swelling in the region of the breast, or sometimes you can see the swelling in your underarm area. And majority of breast cancer, the lump or swelling is painless. So that is why females do not notice it in the beginning when there is a small lump, because it doesn't cause any disturbance to the female. And that is why examining your breast regularly on your own is very important, so that you can detect the lump early and you can take an advice from your doctor. Again, any swelling on the breast area, any color change, and lastly, unusual discharge from the nipple. So you get any bloody discharge or some abnormal discharge from your nipple. These are some unusual signs and symptoms which are related to breast cancer. So it is very important that if you see any changes in your breast, it is always better to talk to your doctor. Now talking about the risk factors for cancer. Now as we all know that majority of cancers, especially breast cancer, there is no obvious cause. Why does the female get cancer? You know, many times we see patients, you know, who come to me, why did I get breast cancer? Okay, so this is a question which comes in every female's mind who is suffering from breast cancer. Why me? So to be honest, the research has not showed enough evidence for the cause of breast cancer, but surely we have some risk factors. That means if you have this risk factor, the chances that you get breast cancers are more as compared to other females. Now this slide I want you to focus on. This is very important, that every female should understand that just being a woman is the biggest risk factor for developing breast cancer. So as we should know that even males can suffer from breast cancer, but the incidence and the prevalence of breast cancers in males is very, very low. So just that our gender being female puts us at a risk of developing breast cancer, that we have to keep in our mind, and we have to regularly screen our breast for cancer. Now talking about other risk factors, I already spoke about gender and being female. Coming to age, so as the age increases, the risk for breast cancer increases. So breast cancer usually earlier was seen mostly in postmenopausal females. So after 50s, there were cases of breast cancer, but now the trend is decreasing. So even in 30s, okay, late 30s and 40s, we get cases of breast cancer. So if you have a family history of breast cancer, so a mother who is having a history of breast cancer, ovarian cancer, sister or your daughter having breast cancer, the incidence increases. Now there are certain 10 to 20% of cases which are linked to genetic factors or genetic changes in your genes which are related to breast cancer, which are inherited, or what we say which are present in our DNA. Certain hormonal pills, so females who are taking prolonged hormonal pills, or what we call as oral contraceptive pills, for various reasons, maybe as a part of their contraceptive, maybe as a part for treatment of certain diseases like PCOS, etc. But females are taking hormonal pills for a longer period of time, usually for more than 5 years, have been associated with risk of breast cancer. And now studies also suggest that females who get menses early at the before the age of 12 years and who get menopause late after 55 are also at risk. Now there are certain studies which suggest that women with dense breast tissue have a risk, and certain ethnicity like white women are slightly more likely to develop breast cancers than African American women. I spoke about menopause, and lastly about radiotherapy. So who are exposed to high radiation, especially in their chest areas, have also in a high rate of developing breast cancer and other types of cancers. Now, after talking about risk factors, we also have to understand there are also 60 to 70% of cases of breast cancer which are seen. The patients without any risk factors are seen to have breast cancer, and only 30 to 40% patients who had these risk factors have developed cancer. So if you remember my slide that every female is at risk of breast cancer, that is why this is very important for us to understand. Now talking about types of breast cancers, this I'm going to talk a little bit about in brief. So as I showed you the anatomy of breast, so you can get the ducts which can lead to cancer, any inflammatory breast cancers, you can have the ducts and the lobules which are involved in the breast cancer, or you have a lobular cancers, or mucinous breast cancer. So these are the various types of breast cancers which can be seen. So these are not important as a patient point of view, but this helps a doctor to treat the cases. Now recently, if you have heard in someone in your family who is suffering from cancer, you would have seen that there are a lot of hormonal treatments which are being given to the breast cancer patients. Now why this is? Because majority of breast cancers have shown to be hormonal positive. Okay, so there are various hormones in the body, will not go into details of it, but basic hormones, you know, that is the estrogen and the progesterone hormones which are present in the females. So these breast cancers are positive for estrogen and progesterone or HER2 receptors. Okay, these are the hormonal receptors which are present in the breast cancer in majority of cases, and that is why they are given hormonal treatment. But 15% of breast cancer will not show hormonal receptors, and that is why the treatment modality changes. So this is just for everyone to be aware that according to the new research, new awareness which has been created, depending upon the type of cancer, the treatment modality, like certain cancers can be treated with hormone therapies along with chemotherapy also. Now lastly, as I said, I'm going to talk about screening or prevention of breast cancer. Now this is an important topic which we should focus on, because every female is at risk. So how to begin screening for breast cancer? This is a question in every female's mind. So what should I do? When should I start? So when you are younger, okay, below age 30, you should be aware of your breast. Like as I said, every female's breast tissue, breast size, okay, varies. So you should be aware how your breast looks. You should be aware about the changes in your breast. And even then, if you observe any changes in your breast, you just talk to your physician, your doctor about the changes. Now, when you enter to an age of between 30 to 39 years, go to a gynecologist or go to a doctor. Take a plan that what should I do to examine my breast? What is my risk of developing breast cancer? So if you have a family history of breast cancer which is very strong, okay, and if you think that you are at risk of getting breast cancer, talk to your doctor. He will explain you about breast self-examination, importance about that, which we are going to talk about also in the next slide. And when every female who is 40 and above, okay, there is a screening mammogram which is done, which is very, very important. Okay, screening mammogram helps you to detect cancer very early. So females who are above 40 years and at least above 40 to 45 years are advised to do a mammogram, which is a simple X-ray of your breast tissue which detects your cancer. As I said, the first step, all right, towards screening or prevention of breast cancer is breast self-examination. This is absolutely free of cost, which we can do at the comfort of your house, which should be done every month. Now I'm going to talk about this detail in our next video, so I'm just going to give you a brief introduction about this. So if we regularly examine our breast, okay, and the underarm area, we can detect so many changes, so many signs and symptoms which I talked about, which is to be encouraged in every female who is 30 years and above, and which has to be done regularly. Now the second part is examination of your breast by doctor. So if you are not understanding, you can go to your doctor, you can ask him, how should I examine my breast on my own? And if you find any abnormalities, you can always consult your doctor, always go to the doctor and get your breast examined. And I have to understand, prevention is always better. So if you have any doubt, it is always better to clear it. The basic aim in cancer, and specifically in breast cancer, because you have to understand, majority of breast cancer, if they are detected early at stage 1, stage 2, they are completely curable, and the female survival rate is almost like a normal female. So that is why the basic aim of this awareness talk is also that you get aware about it and get your cancer detected as early as possible. Now, as I talk about mammogram, so this is how the mammogram looks. So this is an X-ray, this is a 3D mammogram. So some places they do not do a 3D mammogram, so you will get a simple X-ray like image. That is also fine, but it helps you to find the abnormalities in the breast at very early stage, and that is why after 40 years it is very, very necessary to go for mammogram. Now this is a guideline which is given by American Association of Cancer, specifically breast cancer, that they tell you that at the age of 40, the female should talk with the doctor about when to begin the screening. Women should have the opportunity to begin screening if they choose. And after the age of 45, regularly, annually, you should go for mammograms. And at the age of 55, transition to mammograms every other year. So every alternate year, you should go for mammograms. And after the age of 55 plus, you should continuously do mammogram till you are in good health. So you have to screen for breast cancer throughout your life. Here it has written at the age of 40, but looking at the recent trends in India where the cancer is also seen in 30s, okay, so you start your screening breast self-examination right from the age of 30s, because mammograms are not advised at earlier age. Only if they are very, very indicated in females, a doctor will advise mammogram to a female who is less than 40 years. But otherwise, breast self-examinations and sonographies are usually used in younger females in 30s. Talking in last about the new trends which have come into picture for prevention, something called as genetic testing and counseling, or genetic counseling for breast cancer. Now, as I said in the previous slide, that 10 to 20% of breast cancers are genetic. So what do you mean by that? Now these are the genes. These are called as breast cancer gene 1 and breast cancer gene 2. In short, we call it BRCA1 and BRCA2. Now, these are the genes which are associated with breast cancer, and females who have this gene in their blood, okay, in their DNA, have shown to have increased risk of developing breast cancer. So certain female who want to assess their risk, they want to know, is my cancer genetic? Okay, am I genetically linked to get breast cancer? They can use this genetic testing for breast cancer. This is quite expensive than the routine mammography, so it is not advisable to all. But yeah, this is genetic testing is coming up now in breast cancer, and if you have a choice, if you want, you can go and get yourself tested for it. But as I said, only 10 to 20% cases have genetic origin in breast cancer. Rest, still the cause is not very clear. So this was all about breast cancer. Again, I've been posting this video on my YouTube channel, HomeoHeals, and have almost 40 plus videos on this YouTube channel. If you have not subscribed to it, please like, share my videos and subscribe to my YouTube channel. Also follow me on my Facebook and Instagram page @HomeoHeals. And if you want to get in contact with me, this is my WhatsApp number. You can comment on my video if you want to ask me any questions, or you can DM me on my Insta page or Facebook page. I will surely revert back to you. So thank you. I hope this session was helpful to you, and I could create awareness about breast cancer to everyone. As I said, in the next video I'm going to talk in detail about breast self-examination, because many females are not aware that how should they examine their breast. So I'm going to talk about that in detail in my coming video. Till then, take good care of yourself. See you soon in my next video. Bye.